You know that feeling, right? Stepping into a hospital and feeling like you've just landed on another planet? Well, today we're taking a guided tour to decode that world, from the people in scrubs to the incredible tech that keeps us all going. Let's jump right in. I mean, have you ever just walked in and felt completely lost? It's a maze of hallways, right? The signs have all this medical jargon. People are rushing everywhere. It can be seriously overwhelming. And you know what? That feeling makes total sense. Because a hospital isn't just a building, it's more like its own little city. It's got its own experts, its own high-tech gear, and all these different neighborhoods for different jobs, all working around the clock. But what if you had a map to navigate it all? Well, that's exactly what we're going to do. We're going to take a tour and break it all down. The people, the places they work, and the cool tech they use. First up, let's meet the team. These are the experts you'll find inside, the people actually providing the care. Let's start with one of the most intense, high-stakes roles you can think of, the surgeon. These are the doctors who go beyond just a diagnosis. They physically go inside the human body to make incredibly precise repairs when it matters most. Now, while a surgeon might perform heart surgery, the doctor who figures out what's wrong with the heart in the first place is the cardiologist. They're the experts on everything related to your heart and that whole complex network of blood vessels. So, how do doctors see what's going on inside you without making a cut? That's where the radiologist comes in. They're the masters of using tech like X-rays and CT scans to create these detailed pictures, giving other doctors a crucial peek inside. But hey, care doesn't always start inside the hospital walls, does it? Paramedics are usually the very first medical pros on the scene of an emergency. They're out there providing life-saving first aid and getting patients stable for that critical ride to the hospital. And it's not just the medical staff who are heroes. The porter is an absolutely vital part of the team. These are the people moving patients, critical equipment, even furniture, all around that maze of hallways. They make sure everyone and everything gets where it needs to be. The whole system depends on them. Okay, so we've met some of the people. Now, where do they all do their work? Let's take a tour of the main hospital departments. We're back at our map. Now, when you look at these numbers, don't just think of them as rooms. Each one is a dedicated hub of activity, a specialized department that's part of this bigger network. For our first stop, let's go where the action is most intense, a place where precision and teamwork are everything. We're talking about the surgery department. This is where the operations happen. It's a super controlled environment, staffed by surgeons and highly trained nurses. Every single piece of equipment is specialized, and the whole area has to be kept completely sterile to stop any chance of infection. Of course, not all departments are as dramatic as surgery. Let's look at two very different but equally important functions. On one side, you have pathology. Think of them as the medical detectives, analyzing samples behind the scenes to find the cause of an illness. On the other side, you've got physiotherapy, a really hands-on department focused on helping people recover from injuries and get moving again. So we've seen the people and the places. Now let's get to the fun stuff, the tools of the trade. This is the amazing technology that really makes modern medicine possible. One of the coolest tricks in modern medicine is seeing inside the human body without making a single cut. And here are two of the machines that do just that, the CT scanner and the ultrasound machine. Now, they both create images, but for different things. A CT scanner is kind of like creating a super detailed 3D map of your entire body. An ultrasound, on the other hand, is more like a live video feed. It uses sound waves to show a specific organ in real time, which is why it's perfect for things like checking on a baby during pregnancy. But what about in a cardiac emergency, when a heart suddenly needs a complete restart? Well, that's when this incredible device comes into play. This is a defibrillator. Its job is direct, and it is absolutely life-saving. It sends a controlled electric shock to the heart to try and get it back into a normal rhythm. So we've gone from the big picture of the whole body down to a single organ like the heart. But sometimes you need to zoom in even further. The biggest medical mysteries are often solved by looking at the tiniest clues. And for that, you need the microscope. In a hospital, this thing is essential. It lets those lab technicians and pathologists examine tissues and samples super close up, helping them spot diseases at a cellular level. It's just amazing. So, we've got the people, the places, and the tools. But none of them works in a vacuum. The real magic happens when you see how it all fits together. This is really where it all comes together. A cardiologist can't do their job without diagnostic tools. A surgeon's skill means nothing without their instruments. and a lab technician's analysis totally depends on their microscope. No single person, place, or tool can do it alone. Each one is a crucial link in the chain of care. And that brings our tour to an end. We've seen the experts, the specialized departments, and the incredible technology all working in concert. It really makes you wonder, in this huge, complex system, what do you think is the single most important piece of the puzzle for a patient's journey back to health? Something to chew on.